why are children so bad at sleeping? In fact, I would say that this might be part of the normal development of the child, especially during the first years of life. And in many cases, what the parents might consider being a sleep problem, in fact, this might be not an actual sleep problem, but rather part of the normal sleep development of the child. One very easy example is that usually during the first year of life or 2 years of life, so the children tend to wake up quite frequently at night. And of course, we understand that this is not ideal for the parents. In most of the cases, this is a normal part of the development of the sleep-wake cycles of the children. However, of course, if these sleep problems they persist over time or they have a negative impact in the child's functioning on the overall functioning of the family, this is when the parents they might need to seek for advice for professionals. My name is Isabel Morales-Muñoz and my research is in youth mental health and sleep. My research is about investigating the risk factors for mental health problems in young people, and more specifically, sleep problems as a risk factors for mental health. And additionally, I'm also investigating the mechanisms, also which are the explanations by which sleep problems might lead to mental health problems. So to carry out this research, we are using existing data that has been collected in the UK for over 30 years already. And in this data, what they do is they follow up the children and their parents since birth until adulthood. And this allows us, in fact, to investigate how early life risk factors can be precursors of future mental health or physical health problems in adulthood, for instance. So this research matters for several reasons, in my opinion, but the main one that I would say is that, in fact, until recently, sleep has not been considered within the area of mental health research. So basically, until recently, most of the mental health studies, they have not been including sleep as an important factor to take into account. It is true that in the recent years there is increasing evidence suggesting that in fact sleep and mental health they highly or strongly co-occur, and in fact sleep problems might be a risk factor for mental health difficulties later on. And how this could be a game changer. So I would say that this could be a game changer in two important ways. The first one is that by assessing sleep problems earlier in life, we might be able to detect those individuals who might be at higher risk of developing mental health problems in the future. And similarly, by implementing sleep interventions earlier in life, we might be able to prevent or at least ameliorate the development of mental health problems. So what I would like people to think differently or change in their behavior is to take sleep seriously. It is important that the child sleep enough hours, that they feel rested, and it is important to put them to sleep earlier rather than later. And of course, if you are worried that your child might in fact experiencing some sleep difficulties, I would highly recommend to seek for advice before this becomes more severe problems or might lead to other mental or physical health problems.